Aspirin resistance might be more of a problem than you think. From Case Western Reserve University, I'm with a pair of co-authors here, Jennifer Sue Hu, who's a medical student at Case Western, and Sanjay Gandhi, MD, who is a senior author. Okay, tell me a little bit about these patients first off, who you studied in this evaluation of aspirin resistance.
So we studied a population of peripheral artery disease patients, and there are currently no long-term data on aspirin and long-term cardiovascular outcomes in those with aspirin resistant versus those who are aspirin sensitive. There's currently a lot of data on those with coronary artery disease who are aspirin resistant, and they've been shown to have a lot of adverse clinical outcomes. And so we wanted to study this group of peripheral artery disease patients because they also seem to have lots of adverse clinical cardiovascular outcomes. So we thought that maybe that those who are aspirin resistant might be more prone to those adverse clinical cardiovascular outcomes also.
Dr. Gandhi, what do you expect to see in terms of aspirin resistance in a population just normally, and then what did you see?
So in normal population, we expect anywhere from 5 to 15% of patients would be aspirin resistance, depending on what assay you use to measure. In our study, we studied about 130 patients with established peripheral arterial disease, and the prevalence of aspirin resistance was 25%, which is staggeringly high. The key part also, not just that the prevalence is high, these patients tend to do worse. So at 2-year follow-up, which we have for 130 patients, there was 30% incidence of death, MI, or stroke, which are hard key endpoints, and about a 60% incidence of lower extremity amputation or revascularization for patients who are aspirin resistant. And this compared to patients who are aspirin sensitive was significantly higher.
The lesson is that people should start exploring maybe other methods of antiplatelet effect for those who have aspirin resistance and peripheral artery disease.
You know, I think there are studies in the past that have shown Plavix, which is clopidogrel, may be a little bit superior to aspirin, and part of it may be related to aspirin resistance. I think we need more data in patients with peripheral arterial disease. Unfortunately, because aspirin is cheap, it's widely prescribed, but whether this is the optimal therapy for these patients, we need to find out.
And how many patients were you looking at?
So we had enrolled 130 patients for the study.
So 25%, that's a pretty high rate in 130 patients.
Yes, it is. Normally, like I said, we would expect 5 to 15%.
So when you have a peripheral artery disease patient, think a little bit more about the possibility of aspirin resistance, maybe 1 out of 4.
Yes, and specifically, this cohort of patients, we excluded those who had coronary artery disease because majority of those patients now are on dual antiplatelet therapy. So this is specifically patients with peripheral arterial disease and no established coronary artery disease.
Thank you very much.
Thank you.
For CardioSource Interventional News, CardioSource World News, Rick McGuire.